feel like with every project, I have the opportunity to share my expertise, but I'm also learning so much from each of my clients too, because a lot of times we joke, if you've designed, especially once you get into specialty facilities, if you've designed one, you've designed one, because it's so different and from place to place, and even what part of the country we're in, what type of treatment we're talking about. So it can widely differ. So I am constantly learning myself and adding that into my knowledge base.
Welcome to the South Cypress Podcast, where we talk to members of the design community about their stories, knowledge, and expertise. I'm your host, Brandon White. Today I'm talking with Leslie McClenny. Leslie graduated from Auburn in 2008 and joined the team at ESA in Nashville right after graduation. During that time, she had the opportunity to work on a wide range of healthcare projects and learn about evidence-based design. In 2020, Leslie moved to Birmingham and started working with KPS, continuing her work in healthcare design. She spoke at the AIA-IIDA Healthcare Symposium in 2022 on evidence-based design, and that was a huge inspiration to start this podcast. In this episode, Leslie defines evidence-based design and explains how the evidence teaches us to design buildings from the inside out, starting with the people. She talks through EDAC certification and explains where to start if you'd like to learn more about evidence-based design. If you're interested in learning more about evidence-based design or EDAC certification, you've come to the right place. All right, everybody, thank you so much for listening to the South Cypress Podcast. I'm really excited about the guest that we have today. Joining us is Leslie McClenny. Leslie was an Auburn grad. She finished up school in 2008 and went to ESA in Nashville right after that. And then in 2020, transitioned to KPS, where she is doing some great work on the healthcare side of things. If you don't know Leslie, I'll tell you, she's a consummate professional. She approaches her work with a ton of energy and attention to detail, and it's just always a pleasure working with her. And I hope that you had the opportunity to hear her talk about this subject of evidence-based design at the AIA-IIDA Healthcare Symposium last year. I did, and that was honestly a big inspiration for me of why I wanted to do this podcast in the first place. I was just struck by the amount of knowledge in the room from Leslie and the other speakers, and I just thought, there's probably a lot of people that didn't have the opportunity to be here that would really benefit from this. And so that was a big inspiration for why I wanted to do this in the first place. And so, Leslie, it means a lot to me that you would be on the podcast, and thanks so much for being here.
No, thank you so much for asking me to be on here and for all the kind words. My head's going to get big, so I appreciate you though.
Yeah, well, it's all true. Well, cool. Well, we'll just jump right in. And I would start, I thought I'd start just by asking you, when was it that you first knew that you wanted to be a designer?
Oh man, I think I started having interest in design and architecture and floor plans and things like that probably in high school. I really loved looking through my mom's magazines that she got that were more design focused. And I know a lot of times Southern Living magazine it was house plans, but they would have floor plans, and I loved looking at those. And my parents moved around a lot when I was growing up. My dad was in the Air Force, so I would always help them rearrange and set up every time we moved. But it really wasn't until my senior year that I really decided on interior design, because I think I was weighing architecture as well, since I thought I might be interested in that. And then also, interestingly enough, was looking at counseling or psychology, child life. I had volunteered in high school with a children's hospital with their child life group too. So
wow, I didn't know that.
Yeah. So I was weighing sort of a lot of different options and landed on interior design.
Yeah, that's cool. And there's probably some parts of your job where you feel like a counselor between working through all the different people that are involved in projects and things like that.
Definitely good to have that. Yes.
Yeah, that's awesome. Well, cool. Well, what was it about healthcare design in particular that piqued your interest? Because that's a big difference between the Southern Living magazines to healthcare. So.
Absolutely. Well, really being in school is where I was initially exposed to commercial non-residential design in general. And I just think I had no idea what was out there with that. And so automatically, when I was interested in design previously, I think as with a lot of people, we instantly go to residential, but quickly learned that I really enjoyed the non-residential stuff a little bit more than I enjoyed my residential studios. And Auburn exposed us to healthcare as well. And at first, when we found out we had to do a healthcare project, I was not super excited about it because I thought I had interest in other areas, but quickly learned that I really loved it and enjoyed doing research. They had us do research ahead of time, as well as talking to other folks that do healthcare design. And our professor for that studio had experience with that background as well, and just learned that I loved it. It was sort of combining a lot of different passions that I had, being in the hospital setting in high school and as a volunteer, and then getting to participate in it in a totally different way.
Yeah, that's really cool. That's really cool. Well, let's jump in and start talking about evidence-based design. So I think to start with, will you give us a layman's term definition that somebody like me can understand?
Sure. Essentially, the definition is you're taking proven results through research and applying it to the built environment. I mean, fairly simple up front. It's a little more complicated, but you're basing your decisions on design and the built environment for whatever facility you're working on. And it's based on the results that you've already gotten in research that has proved certain outcomes.
Okay. And how long have people been approaching design in that way? Do you know?
I was going to say, honestly, I think it's probably been going on longer than what has been recorded, in the sense of, some of it was by trial and error. Even if you think back to during the middle of wars, and they realized how fast diseases were passing from person to person. And I think it was Florence Nightingale that realized, okay, nobody's washing their hands from patient to patient. There was no sanitizing. There was no airflow in those tents, if you will, where they had. So even just things like that, I mean, that was the beginnings of it. And I mean, and honestly, it probably started well before that. I mean, I think there's references back to even Greek and Roman cultures basing their placement of buildings based on the sun's location. So now how proven is it? I don't know, but kind of trying to take elements and applying it based on other things, I think has been around for a long time. But really it's been in the last, I believe more in the 60s into 70s and on, when it really started ramping up and being a little bit more official research. And then from there, really 80s, 90s, thousands, when things like the Center for Healthcare Design was developed and books started coming out and findings from that research that gets published.
Mm-hmm. Okay. So it's not a new thing, but it sounds like it's really progressed a lot since the 80s, 90s, 2000s. And okay, that makes sense. Well, cool. Well, so tell me about evidence-based design compared to LEED or something like that. Like I know if you're pursuing a LEED project, the building meets these certain requirements, you design it in a particular way, and you end with a LEED certified project. Is that how evidence-based design works?
Not exactly. Because essentially when you become EDAC certified, people become certified in that. And so essentially then you're just applying principles and findings to design. And then, but a building is not necessarily considered achieving a certain rating, like receiving LEED Gold or LEED Platinum or whatever it is that you've reached through that process. Now, there are certain projects where it may be unofficial that you're using evidence-based design in a project and nothing is necessarily documented, there's also projects that can be official research-based projects where you're actually performing research before in the existing conditions, and as well as the testing outcomes in post-occupancy. And then that there are processes and procedures of that that you would go through, but it's still not, that building would not receive necessarily a certain rating, if you will, based on that. It's more so, what is good design? What is, where are you getting the best outcomes for your users, for the people in that building?
So if an end user or a developer is interested in something like this, it's more about them finding a firm or a designer that has expertise in evidence-based design versus some sort of outside certification or something.
For them, yes.
Yeah. Okay.
Correct.
That makes sense. Well, so as you've learned more about this, I'm sure that there are things that you've seen that maybe were common design practices or common design decisions that people have done in the past or are common but aren't necessarily supported by the evidence. Are there any examples of things like that you see from time to time that wouldn't necessarily be a wrong decision, but it just isn't necessarily supported by the data?
I was trying to think of specific examples. I mean, a lot of things have actually been incorporated into common practice or even code, just because it's become so common and so heavily supported in evidence and results. So things like having a window in a patient room, that used to not be a requirement. Now that is. And then same for how many people you're putting in a patient room. They're most common, we're seeing single rooms. Now, on occasion, there's reasoning for two in specific types of areas, but in general, things have just changed through the years. But I mean, as far as, something that's necessarily right or wrong, a lot of it also depends on the type of facility we're dealing with and what outcomes are they wanting? What are we focusing on? What are we trying to achieve? And also, how much money are they willing to spend? I think that's actually probably a bigger piece of that, as far as, achieving things like noise reduction, and the type of materials we're putting on flooring to help prevent slips and falls, cleanability, or if there are falls, preventing further injury. How far are we going in the type of products we're putting on countertops as far as cleanability or fighting those hospital-borne infections? So there's not necessarily, I wouldn't call them right or wrong, but there are certain things that have been backed up by research, but it's not necessarily common practice just because of cost or what we're trying to achieve for a specific type of project.
Yeah,
I don't know if that answered your question, but
no, that's perfect. That makes a lot of sense. Yeah, it's the answer is almost always yes if you've got enough time and enough financial resources, but
right.
Those things are always limited no matter what.
That's right.
So,
that's right.
Yeah, that makes sense. Well, so I have thought about evidence-based design in the context of healthcare, but is evidence-based design relevant to other types of projects?
Absolutely. In that sense, that term evidence-based, and then obviously if you get into EDAC and Center for Healthcare Design, those are very much focused on more healthcare specific. But I think more and more we are seeing research being applied to decision-making for the built environment in so many different areas. I feel like workplace, that's become a bigger thing. You've got furniture companies that are doing research on that and the well-being of the staff and employees and how that affects staff retention, how it affects productivity and therefore profitability for the companies. So I think that's a big thing. In education, I think it can apply there as well. Again, making it more that human-centered we're building the environment based on the people that are in the building, and how do we protect and create a space of wellness for them. And again, a space, if we're talking education, some of it's even would be similar things. How do we reduce noise and help students hear better so they're learning better? How do we provide an environment that helps them focus? How do we make affect acoustics as far as teachers being heard too? So I mean, all different. I feel like those are just two examples, but yes, I feel like this can be applied, and this, not just in the cleanability sense that COVID and other diseases have brought on, and that heightened awareness of that. I feel like just in general, making a space that's focused on the people that are occupying it.
Yeah, as you were talking about that, it actually reminded me of something on the opposite end of the spectrum with Sam Walton when he started Walmart. The early Walmart stores, he would keep track of, if I put a display here, how do people interact with it? If I put one there, how do they interact with it? And that obviously a different level of sophistication and a different end goal than what you're talking about. But I was just thinking that could be applied to a lot of different buildings with a lot of different use cases.
Absolutely. Yeah.
Yeah, that's cool. Well, when you're working on a project and you're trying to make evidence-based design decisions, how does that affect the client relationship? And I'm wondering, if you're going to pursue these things, does it take more buy-in from the client?
Definitely. I mean, some of it, like I said, we're applying regardless. It's become code or recommendation for the best design. And so there's some of these elements we're going to automatically be implementing regardless of what the conversation is with the end user. But absolutely, especially if you're doing the actual research and you're setting that up, and the time and the money that's going to take, and you definitely have to have buy-in from any of the applicable stakeholders, and what we would call a steering committee. So you really have to have that buy-in up front. And then also, okay, depending on what we find, are you going to be willing to put the money towards improving those outcomes with the new building? And then even and it might just be a shopping list, like, okay, where do we want to focus? Are we going to focus on reducing steps of nurses, or are we focusing on slips and falls? Are we going to have staff respite rooms? What is it that they care about? So I think a lot of it does involve having listening sessions with them up front, leadership, anybody else involved in that front end process, to then help define how are we moving forward from here.
It feels like it would really put you in that seat of being the educator to the client, of teaching them what the data says, helping them make those decisions between one path or another based on the data.
I think somewhat, there's definitely part of that where we are coming in and helping them understand certain things better and what we've seen. But I think there's also a lot where we are asking them questions. Okay, what are your problems that you're having, and how can we help become part of the solution, and how can we help you navigate that? So yes, there is an education point, but there's also an education point on our end of understanding who they are, what type of culture do you currently have? Is that what you're wanting to continue, or how are we wanting to change that culture of your facility?
Yeah, that makes a lot of sense. Yeah, in your role, I mean, no matter what kind of project you're working on as a designer, you've got to be a great listener, and just what is this space for? Who are we trying to serve in the first place?
Absolutely. I feel like with every project, I have the opportunity to share my expertise, but I'm also learning so much from each of my clients too, because a lot of times we joke, if you've designed, especially once you get into specialty facilities, if you've designed one, you've designed one because it's so different, and from place to place, and even what part of the country we're in, what type of treatment we're talking about. So it can widely differ. So I am constantly learning myself and adding that into my knowledge base.
Yeah, That's cool. And that's what makes it fun, you know?
Yeah.
Yeah. So if someone wants to learn more about evidence-based design, is the EDAC certification, is that first step to try to develop that?
I think it is a good way to do it. It's an intense way to do it. There's 3 different workbooks you've got to get through and read, and practice tests, and an exam. But at the same time, so I think initially where I learned a lot of my basics of evidence-based design and person-centered design, if you will, is from working in a firm that did a lot of healthcare. When I was at ESA, I learned a lot from those folks who had worked on specific projects where they actually were implementing research, and getting the results, and publishing things, but then also just from, like we've been talking about all along, the good practice. What is the good design in these types of settings? And so I think a lot I learned just from other people around me who have done it longer than me, and have the experience, but then also being able to jump in and learn about things from Center for Health Design. And they have, not all of it's free, but if you go to their website, every so often they have webinars and CEUs that I have found really helpful. Now, as somebody who's EDAC certified, I have to maintain, just like with LEAD and everything else, a certain number of CEUs. So I'm having to do that for credit, but honestly, most of them are really fascinating, and it's directly applies to what I do on a daily basis. But somebody could also, I think, set up an account without being EDAC certified. Don't quote me on that, but I think you can. There is a lot of research you can do on it on the Center for Healthcare Design's website. So I would recommend that as just a first step. There's also an organization called Planetree that has a lot of great information out there. They've made a lot of changes and strides in healthcare as well, just as far as, I think their big push is humanizing, personalizing, and demystifying the healthcare environment. So those are 2 resources I would recommend, but there's so much out there. Once you start Googling, there's probably all kinds of things. If you start Googling evidence-based design and EDAC, all of that. And I think, before you even have to take the steps of studying and taking the exam, I think there's a lot you can learn just through those resources.
Yeah, that's cool. How does an EDAC certification compare to a LEAD certification or a WELL certification in terms of intensity and effort and what's required to be able to get that?
Hey, man. Well, as far as LEAD, I got mine a long time ago. So I think the process has changed. I think I got grandfathered in right before they changed the process.
Okay.
So the LEAD requires a lot more hours for CEU hours, but to maintain that accreditation. But then and then WELL, I don't have that one. So I know enough about it to be dangerous. I know a lot of the principles of it, but I don't know what how the exam is set up. But it is a 1 test situation. It's not 2 tests like LEAD. I believe LEAD is now 2 tests get the full. And I think there's some other requirements there, like maybe having to work on a project to get to the next level or something like that. There's not anything like that. It's purely, it is an intense exam. You have to definitely have read the materials that they provided. I recommend taking some practice exams or practice questions that are in the back of the books to prep. But a lot of it it's applying. It's sort of critical thinking skills. It's not just word for word material from the book. It's, okay, if you were working on this research portion of this project and this has already happened, what's your next step? Here are the options, or what's the best answer? So there could be 2 right answers, but you're going to get more credit for the best one. So I don't, again, probably a wishy-washy answer to your question, but
No, that's great.
So there's some intensity in there, but it's but honestly too, the requirement for CEUs is not quite as big as some of the other certifications out there, which I appreciate. And honestly, like I said, I end up getting more of them than I need because I actually just enjoy the material and think it's helpful.
It makes it a
So,
lot easier to get those credits when you like getting them, you know?
right. And it's not all about, nothing against engineering material, but I feel like a lot of the lead items, once you've worn out all the finish related ones and the architectural ones, you're learning about plumbing and mechanical. So it's a little dry.
Yeah. Not the most fun thing.
Yeah.
What if somebody is like, what kind of prereqs would you recommend, or at what phase of somebody's career would you recommend that they start thinking about this?
Oh man. I mean, honestly, the earlier the better. I know some schools are starting to introduce it. I'm not sure what Auburn's looks like currently with that, but I know even when I was there, even if they weren't introducing something like EDAC, they were introducing evidence-based design and having us do research on our own, and helped us set that up, which was a really cool process. And then I know several years later, it did become part of it. And there were students graduating from the program who already had their EDAC certification,
Wow.
which I thought
Okay.
was amazing.
Yeah.
So just like with lead, well, all of that, anything that you can become exposed to earlier, it's only going to be helpful.
That's great. Well, you mentioned that some of the EBD projects were treated as a research project and a case study. Can you just tell us a little bit more about those projects and what's involved with something like that?
Sure. And I'm going to be honest, I really was only a part of one true project that actually went through the whole thing of that all the research setup of the at the existing facility all the way through. But it was, and two at the beginning stages, I didn't even work at ESA yet, but so I was learning about it after I got there, but then was full on this project from DD's on, and sort of was learning from what they had already done, and then got to watch our principal and kind of carry that through all the way to post-occupancy. But it was really educational for me, especially as a very young designer, to see some of the stuff they were doing. And one of the focuses was reducing falls for patients, reducing injuries for nurses and staff, and reducing steps taken by nurses based on the layout of the patient unit. And so they literally put trackers on nurses in the existing facility, and then did the same thing for little step counters for post-occupancy, and compared the numbers. Also compared the numbers of reported injuries from patients from slips and falls before and after. Same for nurses reporting back injuries or things like that from bending over a patient and not having something like a patient lift or other items to help them and do their job. But in general, I think one of the things that I learned and has stuck with me is the building was designed from the inside out. So often in our world, it's all about what does it look like, and but they didn't start there. That's not where the design started. It started with, what are the solutions to these issues? How can we make this a better space for the patients, for the families, for the staff? And it, of course, part of that is making it aesthetically pleasing and fitting into the environment around it and that community. But at the same time, literally, it was built from the inside out. What is the best layout for these patient rooms? What does that look like once it's repeated? Okay, now what does that do to our outside? What does that do to the exteriors and the window layout? And I just thought that was really fascinating, because I've been in other environments and other projects where it worked the exact opposite.
Wow.
So,
I could see how you could design a really beautiful building that wasn't designed for people, and
yes,
it looked beautiful but not work well.
right. You're kind of shoehorning things in to make it work, but it's not necessarily the best outcome.
Yeah. Yeah. So with one of these projects that's a case study, is it, I'm wondering about the follow-up research and things like that. Is it the architecture firm that handles the follow-up process and documenting that information, or like, can you just, I'm just curious how all that works. Who at the end, if there's a research paper, who's the person that's ultimately responsible for that?
I think it's probably a team of people. Like I said, I'm probably not the best person to speak to that end of it, since I've not, even on the project that I was involved with, I was not heavily involved in the research portion. But I know that once completed, our firm did put together research results and or helped with that process. I think there were some outside groups that were a part of that as well. And I do remember the principal specifically working on that, putting together CEUs that were then part of to share those results and findings with, I think it was through Center for Healthcare Design and things like that.
So it sounds like if a firm wants to take on a project like that, it is a big endeavor to do something.
It does take a little bit of extra time and effort for sure.
Yeah, that's cool. Well, and in this, kind of in the same vein, when you have a client that's really bought in to making decisions based on the evidence and they want to do this and have a people-centric building, how do you typically see that affecting costs and schedules and things like that? Because I know that that's on everybody's mind, and a lot of times that's a really big factor.
Sure. I think there's parts of it that, again, some of it, it's not necessarily a cost question as far as if we're just talking about implementing findings and design decisions. And then some of it is going to be added cost, like because especially if we're talking about patient control, having more control. So if there's going to be a way for them to control their temperature, in their room separately, like that's a lot of times not something that's you're going to get buy-in on, but something like lighting control, that's something that a lot of times there's bigger conversations around as far as, okay, if a nurse comes in the middle of the night and flips on a light, is it going to be the exam light right over their eyes? How can we, and so there are ways of making it where it might be slightly added cost, but again, we're creating kind of a little bit more of a shopping list so that they can choose priorities. And then definitely a lot of this has to be decided on early on, because otherwise it would affect schedule as well. So there's kind of got to be buy-in, not just from your owners, but then also the whole design team too, right? Our engineers and furniture, equipment, everything. So
yeah, that makes a lot of sense. You had mentioned earlier that evidence-based design is really starting to inform building codes and just general best practices. Can you tell us a little bit more about that? And are there any specific things that you've seen change over the last few years or so that were based on the evidence, that we're doing things differently now than we were before?
Yes. And I think two of them I've already mentioned, but windows, having views to outside in natural light. That's a big one that changed a number of years ago. And then
I was not to interrupt you, but when Catherine had had Audrey 3.5 years ago, you're in that hospital room for a solid 2 or 3 days, and I could just imagine I would have totally lost my sense of what day it was, what time it was, and all that if I didn't have a window in there.
Right.
Like I can just imagine, and to be able to wake up in the morning and open the windows and realize, okay, there's daylight out there. It's gonna be okay.
Yeah. Well, and a lot of it's even just being able to see what time of day it is, like you're saying, being able to tell that difference or get any kind of daylight at all, natural light, any kind of views to outside. Of course, some of the views, depending on what part of the building it is going to be better than others. So there's all, research that's gone into that too, of, okay, if you can actually see trees and sky and green plants and flowers, how does that affect versus, okay, I have a view to the outside and natural light and I know what time of day it is, but I'm also looking at the mechanical units on the rooftop. So gotta starting small. But yeah, so we've seen changes in that, again, changes with room occupancy, like how many people we're putting in a room. And I even, think flooring, some of it's not necessarily, some of it is FGI guidelines, things like that. Some of it is not, some of it is more code, some of it is not, but even just seeing the type of flooring or base that's required in certain types of rooms has changed over the years. And if you go into an old facility that hadn't been updated, seeing the type of finishes that are in there versus what would be the requirement now, that has changed, from more seamless things now versus your VCT and basic stuff previously. So there's really been lots of changes. The type of art we do or don't put in facilities, again, that's not a code thing, but it's just pretty much the whole industry has shifted on that as well. And
how is that changed specifically?
Well, again, with the push of for that biophilic design and bringing the outside in, that also applies, not that all art has to be completely nature-based, but you will see a lot more of that. Things that are calming, things that don't cause stress. There's photography, but it could be abstract too, sort of just a mixture of that, but bringing in kind of those naturally occurring colors and images, things that maybe could be familiar. A lot of times there's a push for local art too, just so there's that familiarity too, whether it's recognition of the artist's work itself or it's just recognition of the subject matter. Things like that, anything that kind of helps make something more welcoming, familiar, calming stress. But yeah, so I mean, I feel like there's all kinds of changes we've seen through the years, whether it's actual code or guidelines now, or whether it's just commonly agreed upon direction by the healthcare industry.
Yeah, I could see how, and even the area of the hospital would make a huge difference in choices like that, whether it's pediatrics versus women's health versus behavioral health. Couldn't be more different. And
and same thing, whether it's finishes, MEP items or artwork, we're going to choose pretty wildly different things from one place to the other, depending on the clientele.
Yeah, that's great. Well, Leslie, this has been so great. Thank you for answering all these questions. I feel like I was just pinging you, and I appreciate you doing that. We've talked about a lot with evidence-based design. Is there anything else related to that you would like to talk about, or just anything that, I know there's a lot to say, but
there is no, I thank you for having me on here and letting me talk about it. I love healthcare design in general, and I've been passionate about it for a long time, and love that I get to keep doing it. And the whole portion of the evidence-based design part of that, I am fascinated by as well. So I just am grateful to talk about it. But yeah, and I guess the only thing I can't think of something that's like specific to evidence-based design, but just in general healthcare, really hope that people start learning about it earlier. And I think a lot of times, because students aren't exposed to it, or young designers aren't exposed to it, their view of what it is totally different. And not to say it's for everybody. I know not everybody loves it as much as I do, or some of my fellow healthcare folks do, but at the same time, it really is a neat market to be in, and it does encompass a lot of, I always tell folks, it encompasses a lot of other markets as well, if you think about it, because within a hospital, depending the type of project you're working on, it can have your administrative boardroom executive spaces, it has your coffee shops and dining areas, retail areas with gift shops and retail pharmacy. You've got your education spaces, training. So as well as all of the healthcare. And then with the trend to be more hospitable, you've got your hospitality elements in your public spaces. So I love that it's just, you can have a variety of things. And yes, you're dealing with the codes and the guidelines and all of that a little bit more than maybe some of your other sectors, but you really are getting to touch a lot of different types of spaces. And I think that's part of the fun too.
Yeah. And it makes a huge difference in people's lives. The spaces that you're designing. I mean, it makes a huge difference. I mean, I remember we were talking, this has probably been 4 or 5 years ago now, and I can't remember exactly how you put it, but it was something along the lines of, people that don't know about design, extended family or friends or something like that I talk to, they think that it's all just picking colors and picking fabrics, and it is so much more than that.
Yeah. Yeah, they think I'm selecting the curtains in the lobby. So, which not so much, but yeah, so it is definitely encompasses a lot more, and it is neat because a lot of times these facilities are changing communities, and which is really fun to be a part of.
Yeah, that's great. Well, Leslie, one of the things that I want to do in all the podcast episodes is just ask our guests what's something that's bringing joy in this season of life. It's so easy to turn on the news and not see joy. And so I just kind of want to push some good things out there. And it could be a new flavor of coffee. It could be a fun trip that you're looking forward to, whatever, but what's something bringing you joy in this season?
I feel like I can find joy in a lot of small things, but I think this is probably a common answer right now, but just the warmer weather and the sunshine without it being hot. It's just been beautiful. So I've loved that. I'm one of the weirdos that gets a lot of joy from exercising. So love that. You mentioned coffee. Coffee is always a good thing. Can be a little happy amidst the crazy on a work day for sure. Love my dog is a mess, and I think doesn't always bring joy, but usually enough to make up for the not so joyful parts of it too.
Yeah, that's awesome.
So,
yeah, the longer days and the pretty weather, I just feel like a different person in April than I am in January. I mean, it's just huge. So, and everything that I like to do is outside almost. So that.
Yes, it's nice to just do all kinds of activities out there when we can, whether it's working in the yard or going eating outside with friends and family. So
that's awesome.
Great benefit.
Well, again, thank you for being on. If somebody wants to connect with you or learn more about evidence-based design, is there a way that would you be comfortable with people reaching out to you, or what would be a good way for somebody to touch base with you if they wanted to learn more?
Feel free to email me. I think my email's on the KPS website. If not, I can make sure you have it. Well, you have it. I know you have it. But and feel free to give it out to folks if they reach out. So I think probably email is probably the best way to initially reach out, and then we can go from there.
Yeah, that sounds great. Well, if you're listening to this and you want to learn more from Leslie, let me know. I'll be glad to get you connected. And she's a fantastic resource. So, well, again, thanks so much, Leslie. This was great. I know that I learned a ton, and I think that anybody else that's listening will too. So, and for those of you who are listening, thank you so much for listening to the podcast. I hope that you're getting value from it. And we are going to continue to be looking for more guests. So if you or somebody that you know would be interested in being a guest on the podcast and talking about a specific area of knowledge related to design, or if you just have a really great story to tell about your career, starting a firm, whatever, I would love to hear it. And so let me know, and hopefully this can continue to be a place where the design community can share their stories and knowledge with each other. So thank you so much, and we'll see you next time.